welcome to the monthly PHL Q&A call. So I sent out an attachment about 30 minutes ago via email. So we're going to be going through the SASH assessment as if this were your reassessments, your annual reassessments. So that attachment it can also be found in the materials section of the go-to screen. So you want to make sure that you have a copy either pulled up on your computer screen or printed out so that we can all go through it together. Okay, so let's get started. So our participant's name is Mickey Test Mouse Test. So we're going to start by just pulling up his record. So you can either go to the field staff page where your caseload is located. You can sort to find them easier. So if you just click on any of these column headers, it'll sort by that column header. But I also like to search via the home screen. So we're going to be working with Mickey Test Mouse Test today. And he's right here. So you want to click on him. And first thing you want to do is just double check that all of their demographic information is accurate. So just going line by line with your paper assessment, you want to make sure his or their name is spelled right. We'll check marital status. Looks like he's still living with partner. Gender is male. Social security number looks right. Date of birth I have as February 15th of 1939. So that looks like a typo, so I'm going to go ahead and correct that. And it looks like he did sign a use and disclosure, so that's updated. So this checkbox is still checked. He's still an active participant, and I'm just going to update the use and disclosure date for 2/15. Oh. 2018 is the year. And that actually is still a typo. He signed his use and disclosure on his birthday. What an exciting day. Okay. And save. And then down here, I want to point out people who have HIPAA consent I'll show you where that information is and how to update it. So moving on to Client Contact Info tab. So this will be the client's contacts. Want to navigate to that tab. And just double check that all of that information is still accurate. So it looks like he lives at 123 School Street in apartment 101 in Anywhere, Vermont, with a zip code of 09876. So that all looks good. And it is his primary address, and it is still accurate. Or, I'm sorry, active, still active. And a phone number that he gave was 802-456-7890. It looks like previously that was listed as his primary contact, but it looks like he got a cell phone, so we're going to want to update that information. I'm going to go to New Contact Info. There'll be a phone number. The phone type is mobile. global. I don't think I circled anything. So I'll just put home. And I'll ask him about that later. So the phone number is 802-444-5555. And it looks like this is now his primary. Go ahead and save that. And we'll want to make the old phone number not his primary contact anymore. But it looks like it is still active. And Mickey test, mouse test did not list an email, so we can move on to his insurance info. Just want to double check that all of that is accurate. So it looks like he has Medicare, Medicaid, and TRICARE listed. So I don't need to update anything there.
So just so everyone knows, Madeline's following along on the paper assessment for those of you who joined late. So we're at the top of page 2 at the insurance information on that paper assessment that was sent out earlier, and that's in the materials section.
Thanks, Amy.
You're welcome.
Okay, so it looks like his insurance is good to go, so I'm not going to edit anything there. I will just point out, though, if any of that insurance info is no longer active, you can just uncheck this active box, and it'll say that it's false here. So I can just demonstrate that. So it'll appear as false. So you won't need to ever delete any of this information. In fact, you can't delete any data from PHL. So if you ever want to just designate that it's no longer active or no longer true, there are active boxes in most of the tabs, so you can do that.
Madeline, we have a statement, a comment from Diana. She says, when I put insurance on the paper assessment, I put the number on the top and circle the type. Is that wrong? No, Diana, that's not wrong. So what she's referring to is the top of page 2. We have a spot for insurance number. In there, Madeline had written in what kind of insurance they have. In there, you would put in the insurance number and then below circle what kind of insurance it is. So it's just however you use. Yeah.
Yeah. I clearly don't do these. But thank you for pointing that out. Anytime you see something like that, please point it out. Okay, so I think we'll move on from here and go to the contacts tab. So this will be the client's contacts. Okay, so it looks like first he listed Minnie Mouse on the paper copy as his spouse. She has power of attorney for medical and financial. And, okay, we'll click on her record first, so because she's listed first on the assessment. So spouse, power of attorney, she is apparently medical and financial power of attorney. She is not a guardian. They have daily frequency of contact. And her contact method preference is phone. She is listed to have HIPAA consent. Let's see here. Lost my place. Gender is female. She is not disabled. She is in the household. And okay, so I think all of that looks good. So we'll go to her contact info. And she has a phone number listed as 802-224-5790. Oh, that looks wrong. I think that's a typo. So we'll correct that. What did we say, 5190? Yeah, cool. And this is her primary number, so we'll check that box. Super. And she doesn't have an email listed, so I think we're good there. Moving on to page 3. Great. We can X out of that menu and go on to the next person they have listed, which is Donald Duck, who is Mickey's neighbor. He is not a guardian. Oh, I'm sorry, I forgot to click on him. Not a guardian. They have daily frequency of contact. The preferred method to contact Donald is via phone. Looks good. He does have HIPAA consent. Mail. Doesn't look like he's a primary, so I'm actually going to uncheck that. And we'll go on to his contact info. Does he have HIPAA consent? No? Well, we better uncheck that.
Actually, yes,
he does. Yes,
oh.
Yes, he does.
Oh, he does. Okay. Whew.
He does. Should be verified.
Could have been. And, okay, so now, where are we? I keep losing my place. Oh, address. Yeah. Okay, so we'll go up to contact info. And he has an address listed as, oh, looks like they live in the same building, 123 School Street, apartment 203 in Anywhere, Vermont. This code looks good. And phone number listed is 222-1234. That still looks good. Yep. Oh, and it looks like he got an email address, so let's add his email. So we're going to click on this new contact info. Contact type is email. His email is donduck@email.com. It's primary and it's active. Save. And on to page 4. Needs and barriers. Okay. Out of that. Okay. So I just want to point out that, oh wait, oh, I skipped ahead. Did I skip ahead?
You're in there, you just flip the page over.
Ah, thanks. Got a crew in here. Okay, needs and barriers. So it looks like he listed physical therapy and occupational therapy as a service being provided. So just to point out, these are services already being provided if that is unclear. I think we're going to plan to add some instructions to this. But anything below services being provided, so case management, food, housing, home modifications, etc., those are all barriers or needs, so something that is not currently being provided. So I know that is a little bit confusing. So again, services being provided is something they already have, and everything below that is something that they would need help acquiring, or it's a barrier per se. Okay, so it looks like he already has OT and PT listed. So I'm just going to go through and make sure that I have everything recorded to make sure this is up to date. So it looks like under case management, he would like disability assistance. So that looks good. Under food, home delivered meals. Super. No housing, no home modifications, no utility assistance. And it looks like he doesn't need grab bars anymore, so it looks like we can get rid of that. Maybe he got some grab bars.
There's a question that came up kind of directed to the last bunch of fields you're filling in around addresses that I just want to bring out.
Okay.
Diana wrote, a lot of my people do not have the addresses of their friends and family unless they are on their advanced directives. How important is it that we have all of the contact info for all of their contacts?
I don't think it's important. If they don't feel that they need to list it, it's probably not important. I think that's up to the participant, would be my guess.
Yeah, I would agree. I think it's maybe out of all of those, it may be more important to have phone numbers than addresses if that's possible to get. So yeah. Okay, keep going. Sorry.
No, thanks for bringing it up. Okay, so we're at utility assistance. Doesn't look like he needs any utility assistance. Needs transportation help for daily errands. Under medical, it looks like he has prescription payment listed, so I'll go ahead and update that. Financial, lack of computer internet, so that's still there. Moving on to page 5. Employment, he needs unemployment services. And I skipped over that question, but I think it looks like he has VA benefits. Okay, so I think that's everything for needs and barriers. Next tab is goals and objectives. And I'll just point out that all of the needs and barriers that we filled in will show up above the goals and objectives. So it's my understanding that the needs and barriers kind of motivate the goals and objectives, not always, but a lot of the time.
Hey, Madeline, I just noticed that the grab bars is still listed, so I wonder.
She just didn't hit save.
Oh, no, I didn't hit save.
Oh. So I just remembered you unclicking.
Yeah.
Oops. Yeah.
Save before you move on. Employment. Right?
You meant to do that, right, Madeline?
Hey, yes. Okay. Thanks, Molly. That's in line.
No problem.
Okay. Cool. So that looks, yeah. Okay.
No more grab bars.
No more grab bars. Okay. Goals and objectives.
Don't have too many grab bars.
Does it?
Does it just show because it was historical?
Very interesting. Maybe. Good to know. I'll make a note of that. Okay. So from there, we're still kind of coming up with the overall outline and instructions for creating these goals and objectives. You're certainly welcome to use them as they are right now. If you feel that you've got a good plan for how to use them. I can show you just function-wise. You can add a goal.
Hey, Madeline, can I interrupt before you move on with talking about goals? We have a question about the needs and barriers. Can these lists of needs, barriers, and goals, I guess, be printed and summarized? So I'm guessing Jody's asking if they can be printed and summarized by PHL.
Yeah, no, they can't. Not yet. That functionality is still being developed. From what I understand, they're starting that development up again, so hopefully soon. But currently, no. Good question. All right. So the first drop-down will be the needs and barriers category. So you can pick one of those that you want to focus the goal on, and then pick a specific goal, which is more of like a goal category. So for instance, you could do chronic condition management support is the needs and barriers category. Chronic condition education could be the goal, and then you could type out kind of like the specific goal. So maybe lower blood pressure if it's hypertension. So that's kind of like the general outline. You can add in a start date and an end date and statuses. So if this is a new status or goal, select new. You could also pick one of these that they've been working on and update the progress. So if you're reviewing it, it could be review or achieving. And then from there, you can add objectives. So these would be kind of like specific stepping stones. So like for our blood pressure example, it could be, you know, take home blood pressure daily or something. So, but again, that's just kind of general functionality. You can tailor it to your specific instance. And I think that we will be reviewing this tab to kind of come up with our own instructions on how we think it may best serve the SASH model, I guess.
It's really about the kind of healthy living plan.
Right, yeah.
Yeah. Becky was just asking about that. Is this where we're adding our healthy living plan?
That is the idea, yes. Okay. So that's why I left that blank. So I'm going to go ahead and move on to page 6 at the bottom, which is the immunization. Okay, so it looks like the flu, he was offered a vaccine, but he has an egg allergy this year, which was listed here as well. But I'm going to go ahead and add that anyway because it's new information. And I just want to note that it's still relevant. So no for medical reason, approximate date. You could even do the date of the assessment.
So is it better to make a new one or to edit the old?
I think for the case of the flu vaccine, since that's more of like an annual, I guess I don't know. It can't hurt to add it again. So, I'll just put January 1st of 2018.
Just to clarify, Madeline, because I could barely hear that question, so I'm sure the rest of folks out there couldn't hear it as well. If you're...
It should be entered again if that information is already listed. My answer was it can't hurt to note that it's still relevant. So, I mean, this would at least kind of leave a trail that he was offered it in 2016, he refused for a medical reason, and again in 2018.
Yeah, I mean, I wouldn't go in and edit old information unless it's incorrect. But I mean, as you're saying, like add in new information so we have that trail of when they've received these vaccines or when they haven't because of medical reasons.
Right.
Yeah.
Oh, and I'll put allergy T6 again. And so his pneumovax looks like he received in June of 2017 is what the paper assessment says, so that looks good. And shingles in 2009, so that all looks good to me. If, say, this was 2010 or something, you can go in here and edit.
So we had a comment with the flu vaccine. There's a vaccine that is egg-free, so asking each year with a clarifier of type offered may be a good idea. Thanks, Kathleen. That's a great comment.
Super. Page 7. Okay, so this is the visit details. So we're going to add a new visit, so move on. And he's a full benefit. Visit type is, well, let's say I'm a coordinator, so I'm going to click SASH coordinator visit. And it's a reassessment. And save. First, we're going to fill out clinician's information. So clinician tab is right there. He has listed Melissa Brandon at Alberg as the primary care physician. So she is right here. And what I'm going to do is go ahead and go to these other physicians that are showing as true for PCP. I believe that everyone only has one primary care provider because that's why they're called primary. So I'm just going to unselect those because that's just confusing. Oops. Doctor. That's not even a doctor. Okay. All right. Great. Okay, so Melissa works at Alberg Health Center. We have a phone number listed as 277-3456. That's great. So all of that information looks still accurate. Oh, do you like visiting your doctor? Yes. I'd rather visit another doctor now. Okay, and then save. Okay, moving on to page 8. How fast we're going. I've only been doing this half an hour.
Madeline, before you do, there was a question from Sylvia about how to get other doctors listed in PHL that aren't in there.
Sure, we can go through adding a new clinician.
So that was hard to hear, so I'm just going to repeat what Melissa said. So there was a question about how we can get additional primary care offices added to PHL. So Madeline's going to go through that.
Okay. So click add clinician details if you don't see them listed here. And you can just go ahead and type in their information.
So we've got some additional comments to that Sylvia wrote. 2 major doctor offices for Cal County are missing. We have been putting them in as other, but it's very unhelpful. So it sounds like Sylvia's wondering if they could add in these other 2 county offices that aren't in that list, the practice list.
Yeah, send them my way.
Great. And then Samantha Mitchell asks, when you make an MD false, do you uncheck active also? So I believe Samantha asked, when you make an MD, a doctor false, do you uncheck active also? So I believe by unchecking active, that makes it false.
Yeah.
You just unselect primary care provider, which made it false.
Yeah, so I only unselected the primary care provider because the PCP is listed, or the Mickey test mouse test said Melissa was his primary care provider. I guess I didn't get information from him on whether or not he still sees those other physicians, so I'm just going to keep them active and I'll ask him about it later. But if he does tell me they're no longer his doctor, then yeah, definitely unselect those.
We have another question. If Dr. Jane Smith on this list is the cardiologist, should that be recorded?
Yeah, I think, well, that's a great question. So you can select specialist, And then specialty will be cardiologist. And save.
And so Kathleen, I think that answers your question. And we should clarify specialists like dentist, eye, VA, et cetera. Yeah, so in that list, if you click specialist as Madeline just showed and choose what the specialty is, that will do that in PHL. And then Christy said, and yes, they should add them in. Yes, so please add in specialist. Turn it back over to you, Madeline.
And I don't think it, we can see if we could get specialty added as a column header. That way it's easier for you to look at.
Yeah, I don't know how to find it.
Specialty person didn't just get added there.
Well, he's on there, but she clicked cardiologist, but it doesn't show that he's cardiologist. So
you don't know
right now they just all look like.
Yeah, they could be primary, they could be, yeah.
So Madeline, could you repeat for the larger audience the conversation that's going on there, because we can't quite hear it?
Yes, I think we were just reiterating how nice it would be if it said the specialty as a column.
Oh, in the top table on that page, on that tab?
Yeah.
Got it. Okay.
There's no scrolling.
Your arrow button, it doesn't work because some of them do.
Okay. Is that all the questions we have on clinician details?
Yep. Keep going. You're doing good.
Okay. Did we finish adding the clinician? I don't remember.
No.
Okay.
Right.
Okay. Well, did we? Yeah. So Dr. Goofy, practice. I don't know. Not the primary. Let's say he's a specialist. He does acupuncture. Save, and then it'll save in this table. Okay. Okay, moving on to, where am I?
Diagnoses.
Diagnoses. Thanks, Michelle. Cool. Okay, so I'm just going to check to see what his diagnoses are. So it looks like he has cancer, history of cancer listed. And I'm looking at the paper assessment, by the way. So diabetes, hypertension, congestive heart failure, gosh, and traumatic brain injury. So all of that still looks relevant. Yeah, and I don't know if any of these diagnoses per se would make sense, but if you wanted to go in and make something, so I know like we have diagnoses like infections. So let's just, I'm gonna say that he had an infection diagnosis last year. So I'm just gonna show you quickly how to make something false. So he had a UTI last year. So if you come back in here, I hope he doesn't have a UTI for over a year. That would be really terrible. So you can add in start and end dates for diagnoses. So let's say he told me about this at his assessment last year. You know, you could ask him how long it lasted. So let's say it was like a month or a couple weeks.
So we have a couple of questions in the chat, Madeline.
Yep.
One, Kathleen asked, can the columns that we are not using like ICD be moved so you can see the columns that are filled out?
Are in the table up here? I can certainly ask. Yeah, because like a lot of these get cut off. I know that the quick workaround is to zoom out. So you can see the entire screen.
Eventually, are we going to be using the ICD-10 column?
I don't think so. No, we don't.
Okay.
We don't do real diagnoses.
Okay.
Just
Anne asks, are the diagnoses all current problems only? What about history of, say, for example, pneumonia in 2010?
Yeah, I don't know if we take a stance on recording prior infections. It doesn't seem key to our work. Like if someone had pneumonia 2 years ago, I don't know.
Is Christy on the phone? I'd be curious.
Christy is on the phone. Christy, do you have, are you able to answer that question?
I have her muted, but she could probably, I'll unmute her. Christy, you're unmuted if you want to speak out about that.
So we've got, the question is, do we track history of like a pneumonia? I'd say put it in your notes. It's not necessarily a chronic condition. However, we do have people that have pneumonia every single year, and I believe that that is something that we can check. No, we can't. So you can put it in your note.
Okay.
Yeah, we do
Thanks,
have
Christy.
like pneumonia as a chronic, well, it's not a chronic condition really, but.
A diagnoses. So we have a couple other questions. With the download of data, things are listed 2 or 4 times. Is there any way to clean that up?
So you can't delete data. What you can do is uncheck active boxes if they're no longer relevant or active. But if you had like 2 records of hypertension, so the short answer is no. You just have to leave the multiple records of the diagnosis. When we do start the conversation for doing routine like data scrubbing and cleaning to get rid of duplicate records, we might be able to do that, but that's not on our docket at the moment.
Someone else asked, can we add diagnoses to this list?
Oh, missing. Oh, I see what you're saying. Isn't there another? There is another.
There's an other, but you can't type in what the other is. Like you could put it in your notes, but it doesn't capture it anywhere else on this page.
Yeah.
Right. And I think what we've said before is if you notice that something isn't on there and you're typing other a lot for the same thing, to let us know, because maybe there is something kind of obvious that is missing from that list. But if it's some rare illness, we're probably not going to add it. If it's something where it's like something that everybody's dealing with, then we can see about adding it.
Okay. Diana asked, sometimes people's memories are not exact, so you're going to just by their memories of past illnesses. Yes. So sometimes you're just going to put in there what they know to be true, even if their memory's not true. Kathleen says, I think it would be nice to see historical. Some things would show potential issues that come up again, like bronchitis and pneumonia, right? So we've addressed that. Melissa says she writes in her some of this information in her reassessment visit note. That's perfect. Let's see. Does choosing the header reorganize data into active or non-active on that table at the top of the screen?
Let's see. I have to zoom out. Yeah.
So if people type on the arrows in the corner, they can reorder them by active and inactive?
Yeah.
Okay, great. So Kathleen asked if we're in the process of adding hypernatremia and hypokalemia.
I think
Those are like,
Those are endocrine, right?
yeah, there's like
I thought I saw those when I was doing my,
hyponatremia is in there.
they're in there.
There it is. Yeah, they're right there under endocrine.
And I'll point out, I guess, well, I think this works. So, like if you started typing hyper something, it's supposed to highlight it. Yeah, so I guess not. So that's good to know.
She was also asking Kathleen about thyroid, if there's hypo and hyperthyroid disorder listed there.
Is that also an endocrine? I don't think it is.
It just has thyroid disease, yeah. So in your notes, Kathleen, you can put in if they have hyper or hypo. Okay, sorry, there was a whole, oh, do we let Madeline know if we want something added? Samantha Mitchell asks. Yes, send an email to the SASH inbox with PHL in the subject line, and it will get to Madeline and put in what it is that you would like. Is that right, Madeline?
Yes.
Okay. Sorry, there was a barrage of questions there. I think we're good with questions for the moment, so keep going.
Okay, now these are great questions. So the next section is medications. You should be doing these at your reassessment because it's important information to collect. We are still on hold with entering medications into PHL. The reason being is that list is, so the stored list of optional medications is just, it's just way too clunky. It's not comprehensive. There's two different lists here that I won't even get into. We just really don't feel that it's a good system yet to enter medications. So we're still on hold there. So please do not enter medications at this time. Okay, moving on. Page 9, allergies. So we had the egg intolerance. So let's add allergy details. I don't know what you would call this, egg. Oh, eggs, look, it comes up. I don't know if you would note anything here. Maybe like no flu shot, please. I'm not sure, I'm not a doctor. Save allergy info, and it'll show up on this table. Okay, any questions about allergies? It looks like there are some. Oh, Melissa says that she writes down some reactions, so that would be good information to have. Christy says, please write down the reaction. Okay. And if you wanted to add a second one, be sure to click add allergy details first, so that this will be blank, and then you could add in another allergy. So I don't know, what are people allergic to? Cats? Yeah. Cat dander. So that's pretty, this actually works better than I thought. Caffeine. Do people have caffeine? Wow. That would be terrible. Okay.
Travesty.
Next is vitals. And the layout of this paper assessment, I'll just point out, is in order of the tabs, so that it's easier for data entry. So we're going to add some new vitals. So click add vitals.
We have another comment here too, or question too. Is this where we list allergies to medicine? Yes. When I put in intolerance, not allergy, the system did not allow me to enter it without an allergy. So I'm guessing this person saying, or Anne saying that she, in that field, you can't just add an intolerance. You also you have to put an allergy in there, not just an intolerance.
You could say other intolerance. Where do you usually add in notes?
Yeah.
So.
And you could put under intolerance name. Could you put the name on the medication that they're having an issue with?
I don't know.
Yes.
Yeah.
I think so.
Medication. I don't know what the protocol is here.
Melissa says that she just writes everything under the allergy in the notes, even if it's really just an intolerance.
Okay. So back to vitals. So we do, this is where you put your blood pressures. Please note that this is the systolic and this is the diastolic. I know that these aren't terribly easy to follow. Weight looks like 275 for, wow, that's a big mouse. And 60. Yep, you can calculate BMI. Whew. And save. And it'll show up, and you can sort as well here. So if you wanted to sort by blood pressure, it'll sort there. Sort by weight.
And we have a question from Kathleen. She says, when I open the vitals, it automatically goes to supine. Is there a way to get the cursor to go to sitting?
So I'm sorry, I don't quite understand. The table is sorted by supine? Or
down there, the cursor for some reason automatically shows up.
So she clicks on the vitals. She's somewhere else. She clicks on the vitals tab, and then
right
now
it's like that. That is so bizarre.
Yeah, it says without having to click in the box, it makes it less likely to make mistakes when you are adding new vitals.
Yeah, good catch. I'll make a note. We have made a note, and that's a really good observation. That's strange.
Thanks, Kathleen.
Okay, so moving on to PSMS, which stands for Physical Self-Maintenance Scale. Cool. So it looks like Mickey is independent for everything except for ambulation and locomotion. So these are all drop downs for independence or needs assistance. Save. And it will show every time that was filled out in this table. And again, you can sort by these. IADLS, so independent for telephone and traveling, needs assistance for shopping, independent for preparing meals, independent for housework and medication, and needs assistance with money, don't we all? Cool. PHQ2. I'm going to try and fly through these because we have 10 minutes left. So if you're just following along, this table will show up blank if it's a new assessment. So be sure to save. So the rule of thumb is if the score is 3 or greater, completes the full PHQ-9. So this is a score of 3, so we're going to go to the PHQ-9 and make sure that we do that as well. Total score is 6. Nutrition. Oh, wow. High nutritional risk. That's good to know. Still want to talk to Nikki about that. Falls risk. Oh. Looks like we have a question from Kathleen. Can a prompt be on the PHQ2 where that prompts you to go to the PHQ9? Oh, I see.
So I'm going to read that question out loud. It says, can a prompt be put on the header? Oops, it looks like we just got another one. Can a prompt be put on the header of these tables if scores are indicating when we are to get more in depth? So I'm guessing she's wondering if there's something that could be put up there that can put the score like some of the other tabs that'll tell you if if they're at risk.
Or that you need to go on to do the PHQ-9. It's not listed on there, but it's on the paper assessment.
Right, so the directions on the paper assessment tell you how to score it, which would then tell you what the at-risk numbers would be.
I feel like we can add that in the page sheet.
Yeah,
If a PHQ2 is not ours.
we can see if we can add some more interpretations to the scoring in PHL to prompt the proper protocol for follow-up.
Diana says, I would love this if the whole assessment had one color for SASH coordinator part and another color for the wellness nurse parts and a third color for whatever parts can be either. So Diana, what she's using right now is the full assessment, which is all of the questions on the assessment. We do have 2 separate ones that we just published for wellness nurses and one for SASH coordinators. So if you go in the SASH forum, you can find those. It was listed in the last SASH beat. We shared that information. So feel free to take a look at those for more specific. Okay, so Kathleen said that. I'm trying to use only the computer and this notation's on the paper. So Kathleen was saying she's trying to only use the computer. What I suggest, Kathleen, maybe for now is having the paper assessment nearby so you can do that scoring in your head. And maybe that's something we can look at adding into PHL, but for right now, that's not in the system. Okay. I think that's it for questions. Keep going.
Okay. Okay, what, did we do the nutrition assessment? Yeah. Super. Okay, falls risk history. That's falls risk assessment. Okay. Oh, we have to do that. Okay. So I'm just going through from the paper. I had some trouble. Spin under curb. Okay. Save. Like this guy's at risk. Okay, moving on to, oh, false history is down here. And 14, 20, 17 was his last fall. Cause was what, floor. And A. Okay. SASH Coordinator Assessment. I'm not sure why that one's out of order.
So one thing we want to reiterate is to use the fields when you're making notes about certain tabs, and if there's notes that you want to make for information that is not captured in these tabs, please do not put that information in the note on the tab. That information goes nowhere. It just lives on that tab. In order to see it, you have to go back and click on the date of that visit. So when you're putting information into PHL and you want to put it in a note, please, please, please put it in the Notes tab when you do your encounter notes for that session. We're trying to steer away from putting notes onto the individual tab pages. Thank you, Christy, for that reminder.
That was a terrible note. Okay. Great.
So Kathleen's asking if notes can be printed. She says she sees that some things can be printed for paper copies. She's wondering if notes can be printed.
So currently there is not any printing function in PHL.
It's also not required though. So we ask that the notes be either on the computer or in hard copy, but they don't need to be both. So if you're looking to print the note and put it in the paper file, that's not a requirement. As long as they are on the digital file, it's fine.
Okay. Looks like we're going to use SASH Coordinator Assessment tab next. Not living in the community. They do have documented advance directive. So I guess this would be an A. And actually, you don't need to fill out every question anymore, so I'm going to leave these other advanced directive questions blank. Needs referral for additional services. Reason for referral looks like hypertension management. Okay, page 12. Agency referred to. I just said community health team because I don't know any better.
So Madeline, I just want to point out we've got about 3 minutes left and we've got people leaving the call. So in the last 3 minutes, is there something that you want to highlight before the call ends?
I don't think so. I think the rest of this assessment is, for the most part, it's a lot of the standardized assessments. So you'll want to complete one during your reassessment.
Can you jump to the person-centered interview summary?
We do have the PCI at the end of the assessment. So I believe you're asking all of these questions. These do not have character limits, so you could copy paste an entire page into these.
So we finally have a place that we can record a person-centered interview, which before we couldn't. So there was just a question that Beth brought up asking why the area that the agency you're referring to is in the SASH Coordinator Assessment and not up near the the needs and barriers page, because it seems like it would make sense for it to go there. You need case management, and then you see that you made the referral to case management. And I was just explaining to her that it's because that is a SASH thing that we've made up, the referrals with our specific agencies. Everything on here prior to the notes tab is a PHL thing. So we can't insert into PHL a SASH specific question. So that's why there are some things where it seems like it might make a little more sense in a different location, but we can't put it there. And so that's why it is where it is. That's just what that might be helpful to share.
We have a question from Kathy Morrison. How do we complete the full or low benefit assignment on an existing panel of participants?
Reassigning a program.
I'm not sure exactly what her question is. If you're asking how to reassign people from full to low, or full to low or low to full, there's a desk aid on how to do that. That's in the SASH forum. If you're asking another question, Kathy, just type it in and we'll try to answer it. No, she said the list of participants does not have any assignment.
Oh, from your field staff page? Yeah,
So
yeah.
Okay.
So we have been noticing that lately. I will confirm with PHL, but they might have to know the specific names of those individuals, but let me confirm that before I ask you to send me the specific names. More information to follow.
Okay, it's 10:01. Is there anything else you wanted to add to this, Madeline?
No.
Okay. Sylvia just typed in, I'm still having an issue with switching folks from auto to full, having multiple referrals per each person assigned.
Yeah, so I am having some conversation with PHL around that exact topic. I still don't know how to correct that, or as it's appearing that people are listed in more than one program. The thing is, though, when you go to the referral area, they're only listed in one, so I think it's more of an issue with the interface and not so much the data entry. So I think the process is still correct, that's on the desk aid of changing benefit level. It's just really how it presents in that table on the field staff. I think there's a weird formatting error with the user interface. But I will definitely let you know when I know more.
Great. Thanks, Madeline. And thanks everyone for joining us today. This call is recorded, so it will be put up on the site. And if you have any further questions, let us know. Bye.
Bye.